The National Health Service was nothing short of a revolution. It provided universal health care for Britain's post-war population and funded it through a system of tax and national insurance. By 1945, all three main political parties were supporting the concept.
Our plan is a service which will provide the best medical advice and treatment for everyone, every man, woman and child in this country.
But when the left-wing Labour Party swept to power in the 1945 election, it fell to the young Health Minister Aneurin Bevan to take on the task of making the NHS a reality. In the face of bitter opposition from the medical establishment and despite Britain's post-war financial hardships, Bevan's NHS was established in 1948.
In 1948, it was post-war, with all the rationing. The challenges facing the NHS were very different. Infectious disease was really the biggest killer in those days because we had tuberculosis, we had all sorts of other infectious diseases. So you won't be surprised if you see many wards which were built back in those days, they would have been designed in a very different way. Secondly, cardiovascular disease and cancer. The prevalence of that was obviously the big challenges facing the NHS then.
The NHS changed British society too. MYRA, Pauline and EILEEN were among the thousands of women whose NHS careers in the 1950s and 60s gave them not just employment but advancement. And they were on the front line as the NHS continuously improved patients' chances of surviving and recovering.
When I was doing my general training, if one had their appendix out, it would be in for 10 days. Now, you're out the next night or the next day.
When I worked in A&E, you got definitely emergencies. You didn't get the A&E you see down in the hospital now.
Science has come in more and more, and I feel that's made a big difference.
Today, the NHS is the fifth biggest employer in the world. It now offers more than 2,300 different surgical treatments and treats 1 million patients every 36 hours. Trish Barnes has previously had an NHS heart bypass and is today recovering from a hip joint surgery.
All I can say really is I'm just full of praise for them. Everything they do for us, and the country needs you. The country needs the NHS.
But in an era of tight budgets, the NHS is struggling to cope with the costs of an increasingly elderly population and increasingly expensive treatment options. The medical need is clear, but as the NHS celebrates its 70th year, its future is less clear. Paul Brennan, Al Jazeera, London.